became involved with the menopause, it was with the Baker Institute.
Okay.
By accident. Sorry. I was invited when I was moving out, when I was deciding I had to not stay in theatre and be the anaesthetist and want to get into pain management. I had a year where I was looking at pain clinics and prescribing drugs only, and that was diabolical for me. I couldn't possibly go there. And so I was invited to a function at the Baker Institute called the Greek Women's Health. And I think normally I would have been so busy I wouldn't have gone. But I'm a Greek name, so I was invited as a Greek speaking doctor. And so off I went. And I would never have got there if I hadn't had this year of trying to work out my change. And I arrived, and lo and behold, it was Greek Women's Health. There was some money being given to support some research, because we're interested in seeing how different nationalities deal with.
Yes, that's phenomenal.
Yeah. So basically, I was there, and they said, "You speak Greek?" And I said, "Oh, a little bit, but I do. We want you. Are you working?" I said, "Well, I'm actually having." "You must come." I said, "I don't know anything about the menopause." Well, only from my student days. And it with respect to anaesthesia, it was the one area of the body that I didn't, or physiologically, that I didn't have to learn extra to do my anaesthetic training or my fellowship, because it doesn't change how you give an anaesthetic.
Right.
Right?
Yeah.
Cardiac, everything else does, endocrine, diabetes, everything else will change how I have to decide to give you an anaesthetic. And so our consult for anaesthesia is very different to what I'm doing now.
Yes.
It's that quick honing in on what you have. And so and I think it is important, because you call me all-encompassing. And it was the fact that I went and persevered in the Greek Women's Health at the Baker Institute, and they said they'd teach me everything, and I did. I learned a lot about the menopause, and also about the studies about hormone replacement back then, which was on off, whether it's good or bad. Then the other thing that happened, which is important with respect to me as a physician or as a doctor, that originally when I was there talking to my patients, doing everything I had to do, listening and explaining, but that's important. That's why I wanted to bring it up. It's important to talk, listen to the patient. My Greek patients would be then saying, and I go, they're thanking me effusively, thanking me.
Yes.
And I'm sitting there thinking, I haven't done anything, because my whole training after being a resident was procedural.
Right.
My worth as a doctor, in my eyes and in my feeling, was giving an anaesthetic, putting in drips. Was
compartmentalized, yes.
Well,
so you couldn't
just know my worth, my self-worth as a doctor was that.
Yes.
And this now, me sitting and talking to people and maybe prescribing some vitamin B6 or whatever, and telling them yes about no about hormone replacement, was not. I felt a fraud. That's what I wanted to bring up, because I actually felt a fraud, and I went back and started giving anaesthetics again, actually, because I told I told the director, I said, "Oh, I was doing all this. I'm still doing it, but really, it's not being a doctor." It took me a long time to realize that is being a doctor.
What is that?
Consulting, listening, talking to a patient. You don't have to be
prescribing.
No, not just even prescribing, procedural, because as an anaesthetist, we are always we're doing everything on you. And as an anaesthetist, that was my work. That's how I felt as I was a doctor.
Yeah, that's where you placed your value.
That's where I thought I was valued as a doctor.
Yes.
And it took me 2 years at the Baker Institute. It was really only after 18 months that I started thinking, now, this is important in health. So I had to sort of go back to myself as a resident.
Well, in therapy, we're trained to, treat different clients in regards to their specific culture. You know what I mean? I come from a culture, and I'm sure you can, echo this sentiment, where you don't talk about anything that happens in the home. So that would really be something that you would have to keep in context if you were treating someone from an Egyptian culture or from an Arabic culture. So I totally understand that. But you're right. It informs us. It also helps to broaden the sphere, so to speak, and open you up to be that all-encompassing practitioner, which is what you are.
Yes. And I think I come from a family of doctors. My father was a doctor, and one of the first Greek-speaking doctors here in Melbourne. My brother is a scientist.
Yes, we discussed that. Yes.
So basically, I come from this idea of medicine anyway. But I remember my father being very much the doc. He was a pharmacist before he studied medicine, so he had double
degree. Yeah.
And so but I saw him in his practice and how he engaged with his patients.
Yes.
I think that helped with my Greek patients because I was Greek.
Yes.
So they opened up a little bit more.
Yes.
They can open up a bit. They feel a bit
Well, you're
safer.
a compatriot. They do. You understand the culture. It would be like with me with an Egyptian,
So, but I just wanted to bring that up because most of my patients can't understand how I'm now consulting using laser acupuncture for one thing. And I did bring my laser, it's over there, to show you the laser. But that would be a question that I'm asked nearly by all my new patients. How have you ended up doing what you're doing, having been an anaesthetist and specializing, and then now using tools that are, there is science developing. There is a lot of science coming for this. And in my mind, it's using light, and we all need light. So I'm just targeting light in certain areas to help you.
So I want to expand on that point because you made it really clear to me. I needed to quantify it in my mind what you were doing, and I'm paraphrasing you.
Yes, that's all right.
And just so that we can really understand how your technique really, the efficacy of your technique was that you explained to me that our body is made up of light and cells are made up of light. And they respond light receptors, and they respond to that laser light that you're using. And that was the simplest way for me to then go, okay, now I get it. Now I understand it. And
because we all feel better when when we have some time in the sun.
Yes.
However, the UV rays are damaging, so we limit.
Yes.
So all I'm saying is we know that we are light beings. We understand photosynthesis.
Yes.
For plants.
Yes.
And probably we as single cells, or how we evolved, the light, we can understand that light had to be utilized by the sun, the light from the sun, or the photons, which are particles, particles, had to be utilized by the cell for life.
Yes.
So that's another area, because that's the area of photobiomodulation.
But I wanted to simplify it for our audience.
And it is the fact that our cells have light receptors, photon receptors, and with laser acupuncture, you can sort of target nerves to have a physiological effect, or utilize light to activate a physiological effect on cells. That's probably the easiest way.
Now, I know a lot of people are going to be asking this question. HRT, no HRT. I'm someone, obviously, that can't take hormone replacement therapy. I've done my own research, and there is quite a lot of different research that suggests that if you do have a history of breast cancer, you need to steer clear. Like I said, use the desvenlafaxine antidepressant, which has been specifically prescribed for women that can't take it. But I'd like to hear your take on HRT. What's your research?
Because it's not my focused area. However, when I was working at the Baker, the studies were probably more a little bit against at that stage. There have been some studies that show, yes, people not just having a history, but there was an increased incidence in cancers. So then there was this period of, and my Greek patients definitely would not go anywhere near it.
Yeah.
And then a few years later, there was another big study that said, oh, it's not as bad, or if you only use it for a short period of time. So there's a lot of...
What do you quantify as a short
I
period?
think it was 5 years, something like that.
Okay.
But I would suggest, and this is where I would suggest the Jean Hales.
Yes.
Because
which year?
Jean Hales is a foundation that has been involved, and it was started by Jean Hales, who was an obstetrician gynecologist. And it is a huge network now.
That's a resource.
Of resources for everyone to actually go and get an informed decision from practitioners. There are health practitioners there, but they also have lots of leaflets and
Yes.
online resources that you can obtain, because it has to be your informed, that's my opinion, it has to be your informed decision. No one can tell you yay or nay.
Yes.
They can give you an idea and a direction, but you're the one who has to make the final decision. And I think the Jean Hales, and there is a website.
I actually went to her website, and we will have all that information.
Oh, will you have that?
Yes, we'll have all of that for our viewers. And
because they are leaders. They're leaders in the menopause.
Yes,
and
I found
health.
it incredibly insightful in that they give you the alternative. So they give you a number of symptoms, and then they say if you can't take HRT or if you don't want to take HRT, there have been some studies on the Jean Hale website that support cognitive behavioural therapy.
Yes.
Now, for anyone that doesn't know what cognitive behavioural therapy it is, or CBT, it is obviously going to be a few sessions that are specifically designed to help alleviate your response to certain symptoms. Just so that you know, they don't actually alleviate these symptoms. It is how we respond to symptoms from a therapeutic perspective. But I found her website to be incredibly resourceful, and we will have all that information.
And it's up to date.
It is. It is.
I think that's the other thing. It's up to date.
Yes.
There are endocrinologists. I mean, people there are well-known.
Yes.
Female and mainly, I shouldn't say female, but well-known.
Yes.
Endocrinologists who have been involved with women's health for a long time, who are with part of the Jean Hales.
Yes.
And they have lots, and it's in different languages too.
Yes, which is lovely.
Which is great too. So there are a myriad of different languages. And as I said, it's been around for a long time. And years ago, I went to one of their conferences, but I actually went to the lay meeting as well. I went to the meeting for people, for women.
Yes.
And then I went to the one for medical professionals.
Right.
So I was very impressed with that. So they do hold lots of things that can help women become more informed and understand why they're going through these. What to do, how to help themselves.
It is a change. And the other thing I'd like to actually talk about is what can help you through this change and this transition is because it affects not only you, it affects everybody in your life. And I actually sat my 25-year-old daughter down and said to her that I think I need to manage your expectations of me, because your expectations are me 5 years ago or 6 years ago, and I'm not at that level anymore. And my daughter looked at me and she said, Mum, I don't see you as getting older. Because I didn't look to her in her eyes like I was getting older. And I said, but I am feeling it. And I need you to adjust those expectations because it puts a lot of pressure on me.
Is this on your energy, your ability to do things, or just?
Everything. I was foggy. So I was very foggy. And because I was experiencing a lot of anxiety, I started to actually question if I was,
making the right decisions.
No, if I was actually having on the onset of Alzheimer's, because it takes you there. Anxiety is not logical.
No.
And it doesn't matter what background I have, it'll take you there. It takes you very quickly. And so I had to adjust her expectations and my husband's and my friends. And, I'm fortunate that I have a few menopausal friends. We have different symptoms. But we also have that shared experience of going through this as well, and support.
So with your friends, you'd be talking more about food then, would you, and things like that, or not?
Well, it depends on your symptom. I mean, a common symptom for a lot of women is weight gain. I, touch wood, have not experienced any of that, and I am somebody that does exercise.
But you eat well.
I eat well. I eat.
But that's what I'm saying. You eat knowledgeably.
I eat with intention.
Yes.
I eat with intention, Euahna.
And so I'm saying, people will say, well, almonds and walnut, we know all these nuts are good for you. But then if you have too many, they're not going to be good
exactly,
for you.
Exactly.
But also, I think I mentioned to you the other day, Brazil nuts.
Yes,
Brazil
which
nuts.
I don't like. But
you don't like.
If they're in dark chocolate.
One Brazil nut. Or maybe you have to have some dark chocolate.
I've got some in dark chocolate, actually, because I have dark chocolate every day.
So, yes. So, one Brazil nut, but you don't want to have too many. Moderation is so important because Brazil nuts have selenium, which is very good for the brain. Right?
Yeah.
So, basically, you want that, but you don't want
too much. Walnuts and almonds are my go-to.
Yes, but you don't want too much. Many of those either. There are... someone said, how many should I have?
I'd say a handful. I say a handful.
That's right. And 1 to 3 Brazil nuts, no more.
Yeah. I'll start incorporating that. The other thing that my naturopath actually suggested to me, and you and I have also equally discussed it, is flax seeds, and I buy them and I crush them in a blender and they're just powder. I put them on my salad today, and that helps with estrogen.
And it's the lead up to the alpha 3s. It gets changed. That's what it's another. It's an alpha omega fatty acid as well,
right?
But a different. There's 3, 6. Don't quote me, but 3, 6, and 9. I remember when I was doing my integrated medicine.
Yes.
And there's avocado is one.
Yeah.
See.
Yeah.
But they're all entwined, and you have to have the right balance. However, olive oil's at the top.
Olive oil is a staple in my diet, and it's extra virgin, and it's got to be a good one. So I think the brand at the moment is Molini. Molini. It's so beautiful. But it can be any good extra virgin olive oil,
and it is preferable to have the extra virgin.
Yes.
And then there was I watch on television, which I do. Mosley, I think I forget his name, the British guy.
Oh yes.
And he did a study where they tried olive oil, rapeseed oil, and another one I forget now, and did a study I think this was to lower cholesterol or there was some cardiac. They were studying cardiac status, and one dessert spoon, one dessert spoon, or maybe a tablespoon of olive oil a day. Right. Not heated olive oil.
Yes.
So on your dressing, your bread, whatever.
Yeah.
Cold olive oil. So whenever I go anywhere, I'm always asking for the olive oil as well.
Yeah, and I know, but that on that point, because this is something that I've discussed with my menopausal friends, is that the time of when you eat is a huge factor as to whether or not you put on weight. Look, it's nature, it's nurture, it's genetics, it's environment. But, like you said, Euahna, it's eating with intention. It's eating and enjoying. Like, I'm not somebody that would ever eat a meal on the run. I just won't do that. Because for me, eating is about pleasure. It's about nourishment, and it's about acknowledging the food that's in front of me, that the universe or God has given you, however you want to phrase it. It's important to acknowledge what's in front of us, and
it's very much with respect to Mediterranean backgrounds.
Community.
It's a community.
Connection.
It's the family.
It's connection.
You eat around the table.
Yes,
and it's not the fast food
situation. And it never has been.
No.
It never has been. My mother raised us that way, and so for me, it's our last meal that we will have will be at 6 o'clock, and then I don't eat anything until the next morning at 8 o'clock when I wake up. So you're doing your own little fasting effort. Now that works for me. Everybody is different, and everybody needs to consult their own doctor and naturopath and nutritionist and therapist. And I have an abundance of resources, including yourself, including my own analyst, including my husband, my friends, my family, my children. And it's about really being intentional in the way that you live. You know what I mean? There's no point in eating junk food and saying, I stopped eating at 6 o'clock, but I'm putting on all this weight. There's no point in saying, I've got to, what do they call it when the belly's hanging over and I don't do any exercise. if
It's
pretty simple. It's
it is
pretty
a
simple.
mixture of things.
For me, it's exactly right.
Yeah.
And for me, I'm not someone that wants to feel like exercise is a chore. So it's a brisk walk every day, half an hour to 40 minutes, and it's strengthening, core strengthening for my tummy, for my legs. That's what works for me. That's what I'm happy doing.
But people should find. But the thing is to actually look for it.
Yes.
And find
yes.
it.
Find what works for you.
That's right.
Yes.
Me, I hate the gym.
Same.
I cannot go into a gym.
Yeah.
But I play royal tennis. I think
you do. Yes.
So and that was my gym work.
Yes.
Twice a week I'd go and I'm starting again in a month.
Yes.
But gym, that is my gym work.
Yes.
That is my intensive training.
Yeah.
Twice a week or 3 times a week I would play tennis.
Yeah.
Very strongly, very actively. Heavy racket.
Yeah.
Fast intermittent movements for me. I'm not a long distance person. I mean, I could never run around the oval twice.
Yeah.
I was very short, but people love jogging.
Whatever works
for you.
Different strokes for different folks.
Takes me back to the standard deviation, the curve. We are all different.
Yes.
And some of us we have our phenotypes.
Yeah.
Our phenotypes, our physiological makeup, our genetic, epigenetic. Some things might have worked for you when you were younger, but not now.
Not now. Yeah.
So I think that's important to understand that you've got to
accommodate yourself. The changes.
And don't get upset if you can't do something you used to be able to do.
Yeah, well, like me with the antidepressants. I just realised that I had hormones in my 20s. I don't have those hormones to regulate my moods now. And without the hormones, the fluctuation it was untenable. It was just too much for me to bear and my family. And also too, the fact that we're different isn't a grade of greater or lesser. We've got to stop looking at difference as being
good and bad
and being so polarized. The difference just makes us unique. The fact that I can't play tennis and you can is what makes you great. The fact that I can sit down and do half an hour core workout, that's great for me. Yeah, we have to embrace those differences. We have to get to a point where we can acknowledge that and celebrate it.
I think when we're younger, we understand that. But I think as we grow older, we think we have to go into these different groups of what is best.
I know, but women are so, and I find that women are generally the ones that tend to be the harshest and the biggest critics. We're the harshest critics on ourselves, and we're also the harshest critics on others.
Probably because we're always looking after other people.
Yes. And it's time to take care of yourself. It's time to really, really, all that experience that you have. By the time we get to 45, 50, we don't care what people think of us anymore. We're so comfortable.
No, well, I have to say, by the time, I remember my mother saying when we were in the Botanic Gardens, she went up to a young child who was on a tree, on the branch of a tree, going up and down on this tree. And she went up and said, "Don't do that. That's not, might break." And it was, in fact, that tree has since been pulled down because it was frail. And, my daughters who were with me said, "Oh, yeah, you can't do that." She said, "Look, I'm 85 now. If I think someone's doing something wrong, I'll quietly go up to them and say, I don't think you should be doing that."
Oh, bless her.
But you know what I'm saying? Because you're at an age now where you think, what does it matter?
Exactly.
I am who I am.
I think you realize your time is finite. This is what happened to me.
This is what's happened to you with the menopause, do you think?
I realize that my time...
Not with your parents dying.
I think the fact that my mother died at 43 and my twin brother died at 43, you always have that in your periphery.
Right.
It's always there. And that's okay. I've accepted that that's going to be a part of me until I take my last breath. But I think that from a very spiritual kind of esoteric perspective, the acknowledgement that my time is finite means I can live to the fullest. And I don't make any excuses about it anymore. Like I said, my exchange of energy is something that I will consciously do with someone or consciously not do with someone because I choose not to do that anymore.
That's right, but you're choosing who to be around.
Exactly.
Because there's no doubt that certain energy,
deplete you.
It's certainly
Toxic.
relationships are toxic and they deplete one person's energy.
Yes.
So that does happen. So I understand, and I think the older you get, the more discerning you are.
Discerning, wise, however you want to call it.
Discerning.
And the meditation, because meditation has been a part of my life for 30 years. I have cultivated it as a daily routine. Has helped.
So did I give you a breathing exercise?
You gave me a breathing exercise.
I did give you a breathing exercise,
which helped.
That's right, because as I said, having move out of procedural medicine and being an anaesthetist, it opened up all these practitioners who were doing meditation, teaching meditation, integrative, a lot about diet. And also I had went to conferences. I went to one of the first conferences actually of integrative medicine in Byron Bay in 2002, I think. It's a long time ago. And we were introduced there to these breathing exercises by a Canadian complementary or physician he was. And so I'm just saying that things, you get introduced to a lot of things as a doctor, that you take out aspects. And I took out part of what I was taught to give to my patients, because you can't teach a whole meditation in my practice, but I can give you one little thing that will help.
Yes. And
that double inspiration breathing is a Qigong yin enhancing breathing. But anyway, it and I know it's helped lots of people, but it helped me. And I know. And a lot of what I teach.
You reminded me, because when you're anxious, you're not even breathing.
You actually forget.
Yes.
And even though you've been taught how to meditate, when you're stressed, when you're in pain, when you're anxious, we breathe shallowly.
Yeah. And
and just the ability to breathe deeply helps relax you.
Yeah.
But it also helps your body.
Yes, it does.
Physiologically, it's a great help.
It does.
So that's important.
That is definitely a daily ritual that I've cultivated over a number of years. And God bless you for actually showing me and reminding me.
So I often remind people. They'll say, oh, yes, or the other thing that happens with acupuncture in my experience many, many times is that I will treat someone and often first, talk about meditation or, oh, no, I can't do that. I go, okay. And then I treat them, and it'll be interesting because I'll give them that breathing technique sometimes. But after a while, they'll say, oh, I've decided to join yoga. And I go, what?
Wow.
Because it introduces the idea of that relaxation feeling. Because you know how you felt when I treated you?
Yes.
People who have never felt that before wonder what's going on. So it actually helps them. It's a stepping stone to then use the strategies that they've been suggested to use, but they haven't been able to use. And I think acupuncture is incredibly important with that, or even photobiomodulation. But definitely what I do is very important in that I actually help people step up a ladder almost to then utilize strategies that they know they've been told to do, but they just
you reignite
they have not been able to.
You reignite that for them, which has been incredibly insightful for me. I've walked out of your practice a number of days, blessing you 1 billion times over, because I feel phenomenal.
Thank you.
So, on that note, let's have a quick break.
Yes.
I'll get some tea, and I've got some figs and chocolate dark chocolate. Welcome back to Food for Therapy. I'm your host, Marie-Therese Bolden, with the wonderful anaesthetist specialist, Dr. Euahna Varigos, who's joining me. And just a little bit of sweet, just to finish off our lunch here today, Euahna.
Thank you.
I wanted just to, one thing that I was a little bit remiss in bringing up before that was really important to me in my treatment of menopause was the fluid retention that I had, because I felt like my legs were swelling up with fluid.
And you're not on your own there. And part of the reason is, as we get older, our veins are not as elastic. More fluid leaks out in our lower limbs, in our legs. So basically it happens to everyone, but menopause and the change in hormones accentuates that. And I see that how I use my laser, which I've got here just to show people who.
Can you show them? Can you show them where?
I'll just show how you can.
You can see it.
Can you see
Oh
it
wow!
There? Can you see there?
You can see the light right through. Yes, you can. You can.
And so basically this means that I can target, it is a magic wand. Someone calls it the Doctor Who wand.
No, it's a magic wand, definitely.
That you can target certain acupuncture points.
Right.
On you, I can target on you. Certain acupuncture points, the ear points, for example. And
is that
anxiety? You can tell patients that, can you feel anything when I do this?
Yeah, you usually do that with my ear and I can feel it.
You can feel it on the ear. The ear points, you can actually sense that there's a sensitivity, but it doesn't hurt.
No.
But there are increased sensitivities on the ear, which are pertinent for my anxiolytic, calming down points. But with respect to fluid retention, I really don't have anything else that I can use that can help patients apart from this. And it's called photobiomodulation. I don't want to use a big word, but it's utilizing photons, which are the light, targeting certain areas in the body of what's called the lymphatics. So the lymphatics is the system that helps with our fluid drainage, because if we didn't have the lymphatic system working, it's like it pumps everything up back into our blood, back into the blood vessels. If we didn't have that, then we would blow up, all of us, all the time. So there is this garbage system.
I do actually remember Mum's illness when she was dying, that the lymphatic system wasn't working and she did blow up.
Yeah, that's right.
Yeah.
And so it's a very delicate system.
Yeah.
Doesn't need a lot. So that's why you have to be careful which laser or which light you use, what dose you use. If you use too large a dose, then it's too strong for the lymphatics, and it just doesn't work. But also surgery, all these sorts of things interrupt with the lymphatics. They injure.
They're invasive.
Yeah, and so this is a non-invasive way of stimulating the lymphatics to help patients with various swelling, fluid retention with respect to the menopause. But on another note, when I treat patients post-operatively, which maybe we'll talk about another time, I help with swelling post-op, because there isn't a drug. And people with pain and post-op healing, less swelling means better pain control and better healing.
Recovery,
and recovery.
Yeah. Okay.
So I just thought that is an important
it is very important, because you do, the things that we took for granted before we embark on this journey through the menopause, i.e., your arms being really toned and not having a sag, or, weight gain, fluid retention. I did notice fluid retention specifically in my legs, because my lower calves have always been quite trim. Not my thighs. I'm a woman and I have cellulite like every other woman.
Your ankles were fine. Fine ankles.
Yeah, fine ankles. But I noticed, and I was, what is going on?
And as I said, acupuncture helps with that. So needle acupuncture can help with that. But I just feel laser acupuncture with light that I use, and added LED that I also like. LED.
Yeah. Oh, you use that on me as well?
Yes, because that actually is a very gentle way of stimulating the lymphatics without targeting the neurophysiological.
So specific to your LED, because I know all these new age, what do they call them? Zillennials and Zillennials who'll go out and buy this LED light and think they can do it for themselves. There is a caveat to that. You need to be a practitioner, and you should be trained, and you should know how to treat people. You should be registered. You can't just buy an LED light and go out and treat.
You can't, and I can vouch for that, because I've had my own issues that I've had to treat, and I haven't been able to treat myself. I know exactly what I have to do, but I haven't physically been able to do it.
That's really interesting.
I can't do my own ear points, for example. You can't do them. I was taught that very early, but that may be included in this, maybe not, because it's a transfer of energy. Right. So you can't transfer energy to yourself, especially if you're depleted. So amazing. I had pneumonia once, and I'll just say this, but I had pneumonia, And I was really sick, and I was learning all this, and I thought, oh God, I'm coughing so much. I didn't know I had pneumonia. And I thought, I'm coughing so much, I'm going to do the anti-cough points in the middle of the night. I got up, got this out, gave myself a few points, promptly didn't get better. I have to tell you, I felt worse. And the next day I had a cardiac arrhythmia.
Oh dear.
I know, I had 45 minutes of supraventricular tachycardia. And it was because after that, I then went and had an x-ray, and I had middle lobe pneumonia.
Oh, wow.
And that was right next to the heart, you see.
Yeah.
And I actually depleted myself.
Because it's your own energy.
My own. You cannot treat yourself.
Yeah. But also, too, you're a qualified, certified,
but what I'm saying, I'm just giving that as a, don't include this. This is just for you.
But we could, because I think it's really important. We live in an age where everybody thinks they're an expert without having any education and having any qualifications.
No, that's right.
You've trained for years to be an anaesthetist and then do your Chinese medicine and your acupuncture. And
I did a
fellowship I trained, with my postgrad and my undergrad. And so we worked hard to get where we are. And I think that you don't, it's like anything. If you want the results, you see a professional. That's the reality of it. You can't just buy an LED light and put it on yourself and think that it's going to.
You can't. Some patients say to me, oh, why don't I just buy one of these? How much is it? $5,500. I said, but that's fine. You'll buy it. But I can assure you won't really know how to use it.
Exactly.
It's taken me, I use it now much better than I did 20 years ago.
Yeah.
Because of my experience now.
Yes.
And treating patients, your knowledge builds as doctors. We know that.
Yes, of course.
So yes, there's no doubt there's a limit to how much you can do yourself. And it's important to
leave it to the experts.
Leave it to an expert.
Leave it to the experts.
And, you can find GPs that use laser acupuncture as well.
Yeah. Can you please have some dark chocolate? Because the dark chocolate is full of cherries and mango. The mango is that one.
Is it?
Yeah, mango's delicious.
Mango one. Thank
There's
you.
some beautiful dates. We've got our favourite walnuts, which look like a brain, you told me. They do. They do look like a brain.
I was told by my GP friend that I mentioned to you that I worked with, the integrative GP, well, you don't have peanuts because they're for monkeys, he said. and then he said, and you have walnuts because they look like a brain.
They do.
And they do look like a brain.
And they work
on the brain.
Exactly. So that's really important to have as well. Euahna, thank you so much for joining me today. It's been an incredibly, incredibly wonderful afternoon with you.
Thank you so much. I've thoroughly enjoyed the chat.
Thank you. And I look forward to having you again and again and again. And I wish you all the happiness in the world and the success, because you're an amazing, amazing, all-encompassing practitioner.
Thank you so much.
Yes. And I look forward to having you in my home and at my table again. If you are experiencing any medical symptoms or any mental health related issues, please consult your doctor. Please look for your mental health practitioner. I wish you all the best. And I'm going to leave you with a really wonderful quote that's become one of my favorites, which is, it's not about being in control. It's always about being in alignment. And being in alignment means that you're in alignment, mind, body, and soul, and in thought, and in word, and in action. And that beautiful quote comes about from the mystic Corindero and shamanic practices. It's a beautiful, beautiful quote, and I love it. I'm Marie-Therese Bolden, signing off for now from Food for Therapy. I look forward to seeing you again next time, where we'll chew over an amazing topic again. Bye for now.